Hi everybody. So a lot of people ask me, why do you adjust a baby and why would a baby need to come to a chiropractor? And that's a really good question, and one that I think is so important for all parents to know. Chiropractic is so, I believe, vitally important to help improve a baby's not only their immune system function, nervous system function, but actual growth and development. So systemically, kids get sick, right? Sometimes their bodies break down and they get certain kind of childhood illnesses. So I'm going to show you how and why chiropractic can help with some childhood illnesses and conditions that some babies and infants may have. As many of you know, and if you don't already, you should know that the nervous system, which are the nerves, these are these yellow and green things coming out of here, is encased by the spine. A baby's spine is all cartilage. There's no bone until a baby's about, older, 12, 13, 14, it starts to ossify. It doesn't fully ossify until they're in their 20s. So little baby cartilage bones can shift and move around, like floppy head, or maybe they fall, or maybe just, posturally their head, the way they sleep. And that can irritate or aggravate the nerves. Not that a baby's going to necessarily have pain, but maybe those nerves don't function at 100%. In chiropractic, we call that a subluxation. Babies can get subluxated too. So I always check babies because from the top of the neck here, these are the nerves that go to sinuses and throat and inner ears for things like strep throat, ear infections, congestion, right? The nerves from the middle part of the upper part of the back, these are the nerves that go to heart and lungs. So for things like RSV and breathing issues and asthma when kids get older. The nerves from this middle lower part of the back are the ones that go to stomach for things like reflux and maybe improper upper GI function. And then the nerves from the bottom here are the ones that go to the lower bowel. So constipation. I've seen babies that haven't moved their bowels. That's not healthy. Perhaps diarrhea, maybe colic, right? All of these things can be eased and improved by normalizing the nerve supply with tiny little finger pressure adjustments. So don't think of chiropractic for a baby like you would an adult. It is nothing like that. In fact, a lot of the times I use a little gentle handheld adjusting tool that helps to get better alignment, better motion, better function in the spine, which normalizes the function to the nervous system, and it is drug-less. And it is completely safe and effective. And many, if not all of the babies that come to see me really get healthier and stay healthier because they're under all natural chiropractic care. So if you would like your baby to stay healthy without drugs, if they're struggling with ear infections or asthma or reflux or colic, bring them into us. Let us check them. It is safe, it is easy, it is effective, and that's the best way for your child to stay healthy and well throughout his or her growth and development. All right, Dr. Jody signing off. I'll see you soon.